Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. Next question for you, Christian. What's the out-of-pocket cost for Medi-Cal? I'm wondering about copays. Most of us who have some form of insurance might be familiar with a copay. Is there a copay that's associated with these services, or is the whole cost covered once you're in Medi-Cal?
Yeah, so for most people who apply, who enroll in Medi-Cal, there is no premium or no copayment, and no out-of-pocket costs for most. Some households will see affordable costs, such as a low monthly premium. So sometimes, based on the income and based on the circumstance and the family size, there may be a small fee, but there's also tiers in terms of what they'll look at putting you in to make it more affordable for you as well. For some Medi-Cal children, the monthly premium, it can be something as low as like $13 per child. So it can be really low and up to a maximum of $39 a month. So you're looking at individuals, in Medi-Cal who get the same health benefits available, through Cover California at a lower cost. So you're still receiving that same primary coverage in terms of your family, and also the cost. You really want to look at looking within your network too. So if there's a provider that may not be in that network, after you're approved for Medi-Cal, there's a certain network of providers you must use. But there are circumstances where, for example, you find a provider that's more maybe closer to you, or you get along with them better. There's more continuity of care in terms of service. I've seen this person, 5 years ago, and they got me through a divorce, but they're not in the network. You can negotiate that to where you can continue to see that therapist, and then the county will continue to pay that therapist. So that's another option to know as well when you're looking for a therapist that fits you.
That's fantastic because, as you well know, once you have established a bond or a connection with a certain therapist, one might be, I know I would be reluctant to go to someone else if they were what we've called out of network. So it's great to know that there's some flexibility there to stick with the person that has already been helpful to you.
And even for children too. So even for children, especially in the foster care system, so many foster youth, what happen is they will live in Fresno County, and then they'll establish there's services in Fresno County. Now they're being transferred to another home in Sacramento County. So there's also rules and stipulations when a child is being transferred, from county to county, and who covers that. So there's also it's called presumptive transfer. Is basically when a foster youth is being transferred from one county to another, and would like to continue those same services in a different county.
Really appreciate you walking us through all of that, Christian. What are some of the other services that are available to Sacramento County residents? I'm curious as I listen to you talk, so I know other people are going to be too.
There's a ton of services, but sometimes it can be difficult to find where they are and how to access them. That's the main challenge, and that's what's kind of perpetuates some of the stigma of mental health. Right, is the system is so hard to navigate. So Cal Hope is a good site to start. Cal Hope connects. Offers, it's pretty safe too and secure in terms of the information they provide and the resources they provide. So you don't have to worry about calling these numbers or going to, connecting to these hotlines and being judged, things of that sort. So they have warm lines. They also have hotlines for people who are looking for services in the area, and also provide emotional support too. So Cal Hope is also partnered with some of that California Mental Health Services associations too, and also other associations to really keep them in line in terms of that experience to work, so the workforce of the peers, so keeping individuals in line in terms of providing those mental health services. So there's a lot of regulatory background too. There's a lot of governing things that make sure these people are basically doing what they're supposed to do. So actually, the California County Mobile Crisis Support Unit. It's a team basically that operates within Sacramento County. They can perform mental health evaluations if they're requested when calling in a psychiatric emergency. So sometimes people use this as an alternative to calling the police when someone's having a psychiatric emergency. So That number is 916-890-5467. And again, that's the Sacramento County Mobile Crisis Support Team. So they're basically there to provide those evaluations. If you know a family member or someone who's experiencing a situation in the community. Also, and again, I think we talked about this with the Sacramento County Support Team. Also, they have services down on Stockton Boulevard, and also private out-of-pay pocket. So you have out-of-pocket pay, you have regular therapy, which is covered by Medi-Cal. Even if you do have to pay out of pocket for some private pays, you can also ask for sliding scale fees. So asking, do they have a reduced rate? So that's another option too.
Really, really appreciate it, Christian. Before I should know better by now, Christian, whenever you and I talk, whenever you're on this platform, we need to tell everybody to have a notepad out because you're going to give so many resources and information there. So really, really appreciate the way you come to the table, with everything we need to know about a variety of topics. Really, thank you, Christian.
Oh yeah, no problem, Michael.
You mentioned stigma a second ago, man, and as we know, you and I both know, and everybody that's taking a look at anyone that's in any way a part of what we're doing here at Brother Be Well knows that stigma is still a big part, still associated very strongly with mental health, unfortunately. I happen to think it's a courageous act to even seek out services, to acknowledge you need some help or a loved one needs some help, and you take that step, and we're trying to help you take that step. I needed to ask you, Kristen, from your perspective, it's a bit of a rhetorical question, but I want you to answer it for us. Is there and should there be any negative connotation at all for California residents who are seeking mental health services to access those services via Medi-Cal?
Well, there shouldn't be, but there is, unfortunately. And that's the reality of it, is that there is a stigma behind, seeking mental health services. I think most people wouldn't say via Medi-Cal, they'll just say in general, whether it's private pay, it's Medi-Cal. But I think once they get in the system of Medi-Cal, they can see that it can be confusing. And right now there are programs and work groups within the state system that are working on, making it less confusing, such as the Whole Person Care Program, California AIM project. These are basically project, and also the Behavioral Health Youth Initiative. These are all basically work groups for the state and actually Department of Healthcare Services, Public Health, Managed Healthcare. These departments are trying to find out how to make places a one-stop shop, where a person can go to one place and get what they need versus going to get, drug tested here at this location, and they have to go to their individual therapy here, their NA program here at this location across town, and they have to go back to work. So that's the main challenges in terms of what we hear with the Medi-Cal system. That can be difficult to find available therapies too. So sometimes you may be here's a list of 100 therapists, but only 3 of them are available and 2 of them aren't calling you back. So you have like those situations too. So also finding out a good list, receiving a good updated list of therapists and using a directory, provider directory that each county is required by law to post on their website to show where the therapists are at, what their specialties are, and what their availability is. That's called provider directory. Also, virtual services versus in person. We went through COVID, so that's one of the main things right there is individuals seeing that most Medi-Cal services at that time is changing now. What was via camera, and some therapy services show that it's indicated that it's more effective in person versus how do you do an NA program online versus sitting around 11 other people. So it really takes time to really figure out and navigate the system. Also for the initial appointment too, so time limits. Sometimes it can be a challenge, like waiting for your initial appointment or waiting for you received your initial appointment. Now you're waiting for your specialist to call you, your psychiatrist, or some of that sort. So there's also laws around that. It's supposed to be 10 days for your initial appointment, within 10 days offered, and then it's supposed to be within 15 days for to receive a psychiatrist or a specialist. So these are some of the laws and rights that a lot of individuals don't know, but they're being, you can use these when you call someone up and say, hey, I haven't gotten an appointment in 10 days. So Those are just a few.
And you touched on it right at the top, Kristen. I love the way you put it too. There shouldn't be any stigma attached, but there is. What I was trying to get at there is, I remember back in the day we used to call them food stamps, and there was a lot of stigma attached to those, and the system has since kind of closed that gap a little bit. Now instead of pulling out a special little book of coupons or whatever, there's a credit card or a debit card. So someone at a checkout in a grocery store would have no idea. There wouldn't have to be that. So it sounds like what you're saying there is there's a lot of information to unpack. And as we said at the top of the show, since taxpayers are paying for it, most people have paid into that system anyway. So there doesn't need to be any stigma attached to accessing, going to those sites we talked about, Color California, finding out about your Medi-Cal eligibility, and then getting started. Am I right?
Yeah, you're absolutely right. And also generationally, you can hear the talk. The talk is different. Baby boomer versus Gen X versus Gen Z, versus millennials. Some nowadays you hear individuals talking about their therapy appointments, where I'm going to see my therapist, versus back maybe 50 years ago, you'll call in sick, and how dare you say you're going to see your therapist or your shrink, right? So times are changing where it's more acceptable to talk about going to your therapy appointment or sharing who your therapist is. Hey, go see my person, just like someone would do, getting their haircut, sharing their barber. So.
As public health systems vary across states, we've mentioned it a couple of times. Anybody watching this video, or maybe you're listening to it as an audio podcast, you need to focus your query on your home state and county. I'm wondering, Christian, if you can give everyone in the Brother Be Well family, independent of where they're living, some tips about beginning that search for public mental health services. I'm reminded, one of my nieces always says, Google it. That's her answer to everything. So is that the simple answer here? Someone can type in whatever the name of their county is, and public mental health services and things will pop up? Or are there some other ways that they can go about accessing services in their own home county?
Well, Google helps. Googling it does help after you know what you're looking for. So once you find, where that where your location is in terms of your county, then Google does help find providers. So say, for example, they may cover any therapist that you want to see. You can Google therapists in your area, and then you can say, hey, I want to see this person, and then that therapist is billed. But I'd say start with your healthcare provider. If you are under Cover California or Medi-Cal, I would start by asking your primary doctor how to, get those services and request a referral. That's the first step. For out-of-pocket and commercial health plans, so people who are paying out-of-pocket, I do the same, but the key is requesting a referral first, just so you can make sure to see if it's covered or it can be paid for in a different way. Many times the referral list is outdated. So that's another challenge, and many who are on that list aren't accepting patients. So it's good to continue calling around on that list until you find someone who can accept you and they'll take you in. And also community resources are really important too. A lot of CBOs, community business organizations, have programs that really specialize in finding or offering, free mental health services. And so I'll reach out to your county mental health system and inquire what those community health programs are about free and low cost mental health services in your area. And many of those community centers offer sometimes short-term therapy and supportive services at no cost. So I would say start there and then kind of work your way out in terms of using that network. And then last, like I always say, is, you pick a therapist that's best for you and your condition. You don't have to settle for just having someone who's not helping you and you're not seeing any improvement. If once you get someone, you have the full right to switch up another therapist and find someone who meets your needs.
Really appreciate you, Christian. We could not do the work we do or try to do here at Brother Be Well without advisors, clinical advisors just like you. Christian Jacobs, marriage and family therapist. Thank you, sir. I'm already looking forward to the next time we get to talk.
Oh, yeah, no problem, Michael. Thank you. I'll see you next time.
See you next time, man. Take it easy. And I also want to thank our sponsor for this edition of the Parents and Caregiver Series, Blue Shield of California's Blue Sky Initiative. That initiative boosts access to mental health support. You can learn all about it at bluesky.blueshieldca.com. That's bluesky.blueshieldca.com. Check it out. Check out another website. We mentioned it a couple times today, brotherbewell.com. If you've enjoyed this video and you want to hear a little bit more, see a little bit more, go to that website. Videos, audio podcasts, print pieces, all kinds of resources, links to different websites and services, all designed to help you be well. You can find it all at brotherbewell.com. Check it out. You can join us as a member. We only get by because we got financial members, so we need you to do that if you can. But if you like to start out slow, give us your email address and you'll sign up for our blog 2 or 3 times a week. You'll get notifications when videos just like this one go live. All of that is available at brotherbewell.com. Check it out. My name, Michael P. Coleman, Content Director for Brother Be Well. Thanking you for your time today. We don't take that lightly. Thank you, thank you, thank you. And I'm going to ask you to do 2 quick things for me, if you would. Take great care of yourself. Take great care of yourself. And then take care of somebody else too. Till next time, bye-bye.